long COVID. Now, for the majority of people, when they get coronavirus, it's a mild disease. It comes and goes after a week or two. Some of you, though, are left struggling with symptoms, including lasting fatigue, persistent pain, breathlessness, and many other random symptoms for many, many months. The condition is known as long COVID, and it's having a debilitating effect on tens of thousands of people here in the UK. And I'm really glad that we're speaking about it more. We've heard this week about long COVID clinics that are going to be set up, and research is underway, but many questions are still left unanswered, aren't they? We've had such a great response from listeners, from you guys at home or at work or in the car, wherever you are at the moment, wanting to get involved. And that just gives us an indicator, just working on this radio show tonight, how it's affecting you and how many people are involved in this and how serious a situation long COVID is. I want to welcome our first guest now, Monique Jackson, and she's been living with long COVID since the 14th of March. Welcome to Times Radio, Monique. Thanks for joining us.
Thanks, Kate, for having me.
Monique, tell us about your situation. So 7 months you've been feeling the effect of coronavirus. Just take us through a very brief history. How did you know you had it? And tell us some of what you've been experiencing for the last 7 months.
It started very mild and it swiftly got worse. It began with flu-like symptoms, sweating, shivering. I sort of fell ill on the Sunday, and by Monday I took the day off work to self-isolate, and that sort of turned into 2 weeks, and then it turned into the rest of until now. And the pains sort of grew into palpitations in my chest, muscle spasms, gastro pain, acid reflux. I've had nerve issues with the side of my face and body, as well as shortness of breath. I've had dry eyes and red toes, blue fingers. There are plenty other symptoms, but that's an overview.
How old are you, Monique?
31.
31. So you're in the category that's not meant to be too adversely affected by COVID-19, and yet you seem to have been, horribly affected. How's your day-to-day life been impacted? Tell me what your day-to-day life looks like right now.
Well, I've been told I have abnormalities and problems with my heart now. So my day-to-day is that I wake up. There's always a baseline of pain, and I was athletic before, but now I try and have 10 to 15 minutes walk a day, and that can be quite difficult. My family help me with making my food. Fatigue is constant, and it's tough. It's tough because of the ever-changing symptoms.
Are you working, Monique?
I'm furloughed, so thankfully I've been able to rest when I would be normally in full-time work. But I have been busy keeping a online comic called The Corona Diary.
Yeah, and you must look it up on Instagram, folks. Monique's drawings are brilliant, and they describe perfectly a lot of the situations that you're dealing with, Monique, and a lot of your thoughts in terms of how the pandemic is being dealt with here in the UK. When these symptoms started to persist after a period of time, so let's say 3 weeks after getting coronavirus, was there any doubt from those around you that these weren't genuine? Did you feel almost at odds with what we were being told about recovery rates, and trying to understand why you might still be struggling weeks on from getting it?
When I fell ill, the public weren't being tested who were not admitted to ICU. So because my ECG, oxygen, bloods were normal when I had paramedics come out to me because I had issues with breathing, I asked for my test and I was told no. And this, I unfortunately kept on getting to the point where I had to go to A&E, even though the hospital was the last place I wanted to be. And I was told that testing was not available. So because I never got a test, and my antibodies, when I finally got the bloods, they were negative, I had no conclusive proof that I had been ill. And at that time, there was no name long COVID. No. It was unknown. So I had people doubt me that I was ill, and even I was being assessed for anxiety and issues which I knew to be false because of the pain I was in. But there was no pathway of care because I've had to advocate for myself, and I know that I'm not the only person who's been in this situation.
Yeah, well, there are increasing numbers of you, and you're like the tens of thousands of people who weren't able to get a test. You know, goodness knows how many people have had coronavirus. We'll just not know, will we, potentially, how many people had it in that initial first wave, how many people were suffering in March and April when those rates were high, but there was no testing to back it up. And you're like, you know, several people, Monique, who although you're sure that you've had it, you don't always create antibodies. I think that's kind of a misconception, isn't it? That if you've had it, then you'll definitely have antibodies.
That's right. I mean, I've had someone reach out to me from Austria, and their healthcare system has meant that the person who spoke to me said that they had 3 antibodies tests. The first 2 were positive, and the third at 9 weeks in was negative. And that was the first time I'd heard a first-hand account of somebody who had said that they did have antibodies and then they ended. But at the time I had the test, it was done privately, and the private doctor told me that it was unlikely I'd had COVID. But then when I spoke to NHS doctors a few weeks later, they told me that they were starting to find out that actually it was not a conclusive way of determining whether someone had been ill.
What's your biggest fear, Monique?
I think that there's a lot of questions I've got right now. Like, there's been a disparity in deaths. As a woman who's a person, like I'm a person of colour, there's been a disparity of deaths that the government have acknowledged. And I want to know why. People are quick to say it's socioeconomic reasons, but could it be biological? And I know that there's some research, but I want to find out. I want to make sure there's more research being done into the illness on a clinical level. And there are wonderful people like CoverScan who are starting to do work. And it's really a great concern to me that people behind the CoverScan and COVID symptom tracker app get the resources they need to discover more about COVID, along with there being more testing sites around the country. You know, I was desperate to get tested at the beginning, and that I could not do that, and I would dread to think that anyone would be in that situation again. And I think also another concern for me is Dr. Chowdhury, who died at Homerton Hospital, and which is the same hospital which I've been treated at, a fantastic service, and he warned about the PPE crisis at the time. And I hope that his death would not be in vain, and that people learn that we need to make sure people on the front line and in care homes have adequate PPE.
We have been reassured about that today. That is the line, that there is, you know, plenty of stock, up to 4 months readily available stock at the moment. But you're right to raise it. Of course, it was a huge issue the first time round. Let's visit again your question about why people from minority ethnic backgrounds appear to be suffering disproportionately, and we'll pick up with CoverScan. Actually, really pleased to say that Perspectum are feeding into the study, which is CoverScan, which is looking at the health looking at the health on multiple organs, if I can get that out right, in terms of people who are suffering from long COVID. So in other words, if you're a long COVID sufferer, what is the long-term impact on the health of your organs? We're joined by Dr. Rajashi Banerjee, who's CEO of Perspectum. Welcome to Times Radio, Doctor.
Thank you very much. Please call me Banjo.
So we call you Dr. Banjo, do we?
That's absolutely fine, yeah.
Okay, all right. It doesn't feel particularly formal, seeing as I'm speaking to a doctor, but if this is your wish, we will go with it.
I think, Katie, that's a good thing. Doctors need to be a bit less formal.
Okay. We've just heard from Monique Jackson, who actually pointed us in your direction. So thank you, Monique, for that. She was really interested in the research that you're doing. Just tell us a little bit about it. So you've got one set of results. Who are you looking at, and what are you doing in order to get some understanding of long COVID?
Well, thanks for asking. Um, we're looking at how we can. Firstly, we're looking to see if long COVID is real and what it is, because um, everything we know about coronavirus has occurred in the last 6 months, and we know maybe 1% of what we will need to know to completely get past it. So there's a lot of unknowns. My background is in medicine, and Perspectum's a company with physicians, scientists, engineers. Sir Mike Brady, who's head of the Cancer Research UK Early Detection Committee, and we're really good at imaging the body. And we do the imaging for UK Biobank, and we've developed scans that mean you don't need to have liver biopsies. And we're also looking at developing new ways for detecting early breast cancer. But when COVID broke back in March, lots of people asked us, well, you guys are really good at scanning the body. Could you look at COVID in the lungs? Because back in March, it was all about acute admissions, who was going to hospital and did they have COVID and how could you see it? And I said, well, you can do that, but you don't need really smart engineers or software engineers to do that, because the changes when you looked at the lungs were pretty obvious. What we didn't know was what COVID did to the rest of your body. And we also didn't know whether COVID had any long-term impacts.
So this is looking at the heart, liver, kidney. Sorry. So this is looking at the heart, liver, and kidney.
Exactly. So my colleague Mary Zhu over Easter designed the study and started it within a month. And it was funded by the European Union and Oxford University's National Consortium for Intelligent Medical Research, as well as our own shareholders. And effectively, we wanted to see what COVID did to the rest of the body. And the findings really partly explain why young people who are traditionally thought of as being low risk, so Monique, who was just on, is in her early 30s,
31.
Female, young, yes, working full-time prior to COVID. These are the people that we were told, just get herd immunity, nothing will happen to you, you'll feel lousy for a couple of days, and then you'll be back at work. And what we're seeing is this is not the case in everyone. Now, I don't want to scaremonger. Most people who get COVID will recover near fully. But there are a group of people, probably between 10 and 20%, according to Professor Spector at King's, who have persistent symptoms beyond 3 months. And as a medical profession, we must learn to trust patients' symptoms. If they say they're unwell, people like Monique are not making this up.
Yeah.
And if we as a profession cannot explain it, it's our job to try and find out why those symptoms exist rather than dismiss them. Does that make sense?
Yes, it does. Let's bring Monique on. I want this to be a bit of a shared experience with our case studies, with people listening at home as well. I've got plenty of questions from them, and I know that you're going to be joining us for the next half an hour or so, Dr. Banjo, which I really, really appreciate. Monique, do you want to aim a question at Dr. Banjo?
Thank you, Dr. Banjo, for everything you said. It means so much to me. I think I'd just ask about what have you learned since doing this about COVID? Has there been anything unexpected?
So from when the study was conceived, what I had hoped is that it would be great if we could report that all the organs were completely normal. The best result we could have reported is what scientists call the null hypothesis, which is that nothing has changed. The one thing I can say is from the first couple of hundred people that we've scanned, we cannot say that. There are definite changes in organs. The organs include the heart, where there's signs of inflammation, the liver, where there's signs of fat infiltration and inflammation, the pancreas, again, fat infiltration and inflammation, and the kidney, where in some patients there's some inflammation around the edges of the kidney. Now, what we can't do is say whether patients had these changes before COVID, and perhaps that's why they have long COVID, or whether they developed these changes as a consequence of COVID. The only way you can do those kinds of what we call causal studies is to see people before and after they've been exposed to the infection. We can't